Hello again, everybody. For those of you who are not aware, my name is Tanner Lapointe from the Schizophrenia Society of New Brunswick. Today, we're going to be talking about anxiety. So, what exactly is anxiety? Anxiety is a biological brain disorder. It involves excessive worry and excessive fear, often for no clear or particular reason, and for those affected by anxiety, it can be very distressing and even debilitating. Anxiety disorders are vastly different from the normal fears and stressors that everybody experiences in life. So, what exactly are some of the symptoms of anxiety? We can break down the symptoms of anxiety into two major categories: physical symptoms and psychological symptoms. Some of the physical symptoms of anxiety include rapid breathing and heart rate, chest pain, sweating, and nausea. Of course, this is not an exhaustive list. Some of the psychological symptoms of anxiety include excessive worry and fear, feeling nervous or on edge, a pathological fear of the future, and social withdrawal. So, what exactly causes anxiety? Like most disorders, there is no one specific cause of anxiety. However, there are certain factors that may contribute. Some of these factors include a genetic predisposition, which is a family history, so somebody in your family who has had anxiety, stress, and trauma. These are some of the factors that can contribute to acquiring an anxiety disorder. So, how exactly are anxiety disorders treated? Anxiety is often treated with medication. The most common medications used to treat anxiety include antidepressants, most commonly selective serotonin reuptake inhibitors, often referred to as SSRIs. Selective serotonin reuptake inhibitors work by rebalancing the levels of serotonin in the brain. Some SSRIs include Prozac, Cipralex, Zoloft, and Celexa. Of course, this is not an exhaustive list, there are many others that may be used. In some cases, benzodiazepines may be used in treating anxiety, especially if the individual is experiencing panic attacks. Benzodiazepines work by acting on the GABA receptors in the brain and depressing the central nervous system, thus leading to a calming effect. Some benzodiazepines that may be used include Ativan, Valium, clonazepam, and Xanax. Again, this is not an exhaustive list. There are other classes of drugs as well that may be used to treat anxiety disorders. Psychotherapy and cognitive behavioral therapy may also be used to treat anxiety. These are often used in conjunction with medications. Having a family support system is also very important in mitigating and managing the symptoms of anxiety. Everybody needs a support system. Getting adequate amounts of exercise and maintaining a healthy diet is also very important in managing the symptoms of anxiety. So there are many different types of anxiety disorders. Let's talk about a few of them. Panic disorder is a disorder in which the individual experiences panic attacks. These attacks often come without warning and can be very distressing. In some cases, the individual may actually feel they are having a heart attack. Social anxiety disorder is a disorder in which the individual experiences pathological and often irrational fears about being in social situations. The individual is often fearful about being embarrassed or observed in public. This disorder can be very distressing. Agoraphobia is a disorder in which the individual avoids situations out of fear that they may have a panic attack. Generalized anxiety disorder is a disorder in which the individual experiences frequent and often chronic worries about everyday situations. They typically expect the worst. Let's talk a little bit about positive coping skills. How do we cope with anxiety? So, there are some ways we can cope with our anxiety and help to mitigate symptoms. Some examples include getting adequate amounts of sleep. Typically, 6 to 8 hours is recommended. Sleep deprivation can contribute to anxiety symptoms. Maintain a healthy diet and get plenty of exercise. Avoid unnecessary triggers. For example, some people may be bothered by the news, and if that's the case, don't watch the news or limit your intake of the news. Practice spirituality. Everybody has a different idea of what spirituality is. It does not necessarily have to be grounded in religion. It could be something as simple as appreciating nature or looking out at the stars on a nice night. Use aromatherapy. Some people find the scent of lavender relaxes them. If that's the case, utilize that. Limit caffeine and alcohol intake. This can contribute to anxiety and induce panic attacks. Utilize deep breathing. When you're stressed out, take some deep breaths. Count to 10 very slowly, and ask for help when you need it. If your symptoms are too much to handle, seek professional help. I would like to thank you all for taking the time to watch this video today. I hope it was very helpful and informative. For your benefit, in the description I have included some contact numbers to various agencies if you are seeking help. Please remember, however, if you are in crisis, call 911 or proceed to your nearest emergency department as soon as possible. I have also included some links to various websites if you're looking for more information about these topics. If you have not yet watched the video on clinical depression, I encourage you to do so. Please also stay tuned for our next video where we will be talking about psychosis. Thank you all, have a nice day, and remember, recovery is expected.